Welcome to the Institute. I'm delighted that you're all here. We're still going to have a couple of our guests. We have some of our Board of Trustees who are here for one of our board meetings that coincides with this event and commencement. But I would like to welcome you all to our annual IWP Student Symposium. It is a wonderful event which we are so proud of, and we are recording it for posterity. So those of you who are speaking will have a bigger audience than you imagine. And I wanted to thank very much the organization of IWP's student ambassadors who are responsible for having conceived of and then organizing this event. Our student ambassadors are our students who help represent us and help as hosts here at different events that we have, and are part of the public face of the Institute, and we're very proud of them and their energy, loyalty, and enthusiasm. So I'd like to introduce actually all three of our speakers now at the beginning. And first, I would like to introduce Katrina Klaus, who is graduating this Saturday, the class of 16. Katrina comes from Valhalla, New York, is graduating, as I said, with a degree in statecraft and international affairs. She has a bachelor's in international affairs from Roanoke College, and she's currently working as a contractor with the Department of State on matters of diplomatic security, and after she graduates, she will continue to be associated with this State Department operation. She will be speaking on global pandemics, very specifically about the Zika pandemic. Next, we will be hearing from Jamie Loizo, also graduating this Saturday. Jamie has been extremely active here in the IWP community. She's graduating with a degree in statecraft and national security affairs, specializing in public diplomacy and political warfare. She's currently working with Banner Public Affairs, where she researches defense procurement and acquisition trends and creates communications strategies for defense contractors. And I just wanted to express my gratitude to Jamie for all she's done to contribute to IWP for the whole time she's been here. And then we're going to hear from Brandon Weichert. Brandon is also graduating this Saturday. Brandon is a former congressional staff member and veteran of a number of Republican political campaigns. He has long been interested in space issues about which he'll be speaking. Brandon holds a bachelor's in political science from DePaul. He's an associate member of New College at Oxford University, and he is interested in pursuing his PhD in international relations. By the way, I neglected to mention that Jamie is going to be speaking about Lebanon and its future, and Brandon will be speaking about space policy. So without further ado, Katrina, the floor is yours, and thank you so much.
Thank you.
Please turn off your cell phones if they're on.
Okay. All right, everybody. My name is Katrina, and I'm going to be talking to you today about global pandemics and assessing the Zika virus. I'm personally interested in public health, and so with the Zika virus as a current emerging threat into the United States, I thought it would be pertinent to discuss this today. And I want to tell you how one death in rural Thailand can affect Americans abroad all the way over here. So, this is very important. Okay. So first, let's discuss what infectious diseases are. We have to first define the problem. Infectious diseases are not a new threat. Most Americans are very familiar with the flu. And I have here some statistics on the number of deaths that these diseases have resulted in. So these viruses, as you can see, are very deadly. Influenza has the largest death toll with 50 million people within 3 years. Smallpox is next up with 300 million, but this is over a larger time span. But again, this one is, I almost want to say, more dangerous because we do have a vaccine for it. However, there are still cases that pop up every now and then. So the Spanish influenza pandemic in 1918, which resulted in the 50 million deaths, resulted in a higher death toll than the total number of soldiers who died in battle in all the wars combined in the 20th century. So infectious diseases are a really big deal. The current face of threat today facing the United States is Zika. And the WHO, the World Health Organization, declared it a pandemic earlier this year, and it has recorded 1 death thus far in Puerto Rico. So before addressing some of the risks of infection and some viable solutions, I just want to take a step back and first introduce you to the Zika virus. So the name Zika comes from a forest in Uganda where the virus first appeared in primates in 1947. Scientists had contained the spread of humans of this virus at that time, but over time it then further spread to Southeast Asia, later islands in the Pacific, and in 2015 popped up in South America, chiefly in Brazil. The virus that is now active in Brazil and is spreading to North America is an evolved strand of the previous Zika virus that was seen in Uganda. As of today, there is no vaccine or treatment for the Zika virus, and as I said earlier, it has laid claim to 1 death in Puerto Rico. So Zika. Zika is a mosquito-borne illness that produces flu-like symptoms. So 1 in 5 people infected will express these symptoms, normally lasting approximately 5 to 7 days. They're flu-like and they include fever, rash, joint pain, and conjunctivitis. But something unusual about this strain of the flu is that it has a causal relationship between 2 disorders, one called microcephaly and the other one Guillain-Barré syndrome, which is a neurological virus that causes paralysis. While these flu-like symptoms will dissipate after a week or so, this disease can still linger in your body. And for females, this is exceptionally important to note because it can affect pregnancy, as seen with microcephaly in cases in Brazil. So the graphics I have up here are cells of the Zika virus under a microscope. And then seen here is a picture of an infant whose head has microcephaly and the other one a typical head. And so then just at the bottom, a case in Brazil where this infant does have microcephaly. These cases can lead to death. So, transmission. How do you get Zika? So as I mentioned, it's a mosquito-borne illness. Similar to those such as malaria, yellow fever, and dengue fever. And the main mode of transmission for this is these 2 mosquitoes right here, the yellow fever mosquito and the Asian tiger mosquito seen here. They are the only mosquitoes to date that carry the Zika virus and are found in subtropical climates. These mosquitoes, the mosquitoes that bite you and then infect you with the virus are female. And the idea to combat this threat is to affect the eggs of the female mosquito. In order for somebody to get sick from a mosquito-borne illness, you have to get bitten by a mosquito. In the case of Zika, it's not limited to only a mosquito bite. It's found to be also sexually transmitted. The threat of a mosquito-borne illness varies to an extent with the seasons, and as the summer approaches the United States, the threat of contracting Zika increases. Most people do not really view mosquitoes as a serious threat, but this pest can actually lead to up to 500,000 deaths annually worldwide. And that's a combination of statistics of malaria, dengue, and yellow fever as well. So next I have a map of areas infected with Zika cases. And this is Zika cases as of 2015. As you can see, it's all over South America. It continues into the Pacific Island region and spreading upwards into North America. It is not noted in Africa, where the original Zika virus was expressed, because it is a mutated kind of strain. So that's the only reason why it's not showing right there. So a little risk assessment. How are we vulnerable to this? So the United States is vulnerable first and foremost because there is no vaccine. There is no treatment to address Zika. Unfortunately, there is an increased risk to pregnant women, which again results in the microcephaly and Guillain-Barré syndrome. But despite this risk, it is not as high of a risk in the United States as it is in underdeveloped countries. The U.S. does not have an outbreak of Zika at this time. However, our colleagues in the public health field are increasing surveillance to detect locally acquired infections, and there are cases of Zika in the United States. There are currently 544, which none are locally acquired. These are all due to travel outside the United States and then cases brought back in upon return. And they are scattered across the U.S. The U.S. is a leader of global health governance, and the CDC and the Peace Corps work with local foreign governments to spread awareness about infectious diseases, and right now Zika, and preventative care measures, and if possible, can provide aid to these governments. The underdeveloped world has a much higher risk, like I said, of contracting disease because of low-income communities, lack of healthcare infrastructure, ineffective policymakers. It takes a toll on these areas, and as seen with Ebola in West Africa, allows viruses like these to run rampant and unchallenged. So lastly, our strategy. What do we do about it? The U.S. leads the response with our improved technology and scientific expertise. The White House has authorized over $1 billion to the Department of Health and Human Services. In fiscal year 2017, $629 million has been allocated towards the CDC's protection of Americans from emerging and zoonotic infectious diseases, which targets diseases like Zika. The CDC publishes a global health strategy, and it has done one for 2012 to 2015, and highlights the importance of partnerships with foreign countries. We need to work closely with these international agencies and local municipal governments in order to shape global health policies and to fund, implement, and evaluate programs to prevent the spread of diseases like this. Global health challenges cannot be solved by one state or agency alone. The U.S. cannot do it on its own because it needs this interaction with foreign governments. And in the case of infectious diseases, what we don't know will hurt us. So it is utmost importance to address these emerging threats now prior to the next outbreak. Some things that are coming up are, I added this genetically modified mosquitoes. Something that's ongoing right now under testing is scientists are taking the mosquito and they are injecting it with a certain new material, and then the mosquito would then mate with a female mosquito, which would produce eggs. At which point, the material within the egg, within the larva, would disrupt the life cycle and cause it to die. So this would essentially eradicate the species of mosquito. There has been pushback on this, but it is something, a viable solution that the United States is taking, and as well as some of our international partners to address mosquito-borne illnesses. That's it. That's all I got. Does anyone have any questions on Zika?
You said at the beginning that the vaccines were available, but then it said it wasn't available.
No, I'm sorry, there are no
There are
vaccines.
no vaccines.
There are no vaccines available for Zika right now.
I guess they're trying to develop some.
They are trying to develop some. Treatments are undergoing, but nothing has been confirmed or produced yet.
Right.
Nothing yet. It can take a lot of time to create a viable vaccine for something like this.
I had a couple of questions, Katrina. How, when can this start adversely affecting a pregnant woman? Is it early in the pregnancy, or if the woman contracts it late in the pregnancy, can it still have the adverse effects?
It can affect the pregnancy at a later stage in the pregnancy. A woman can get bit by the mosquito and then will cause disruptions in the brain development.
Kim, I want to also ask you about DDT.
Okay.
DDT has been off the screen for 40 years or something like that.
Mhm.
And yet, when DDT was used a long time ago, it really worked. And then we stopped using it, and millions of people died of malaria and so on and so forth. And I'm wondering, is there any discussion about this? I mean, it's obviously has some downsides to it, but the downsides, as far as I can understand, were not as grave as what they were hyped up to be, especially in light of the consequences of not using it. And I'm wondering, is this part of the debate at all?
It is to an extent, but more focus has been pushed towards preventative measures. So while DDT is still in discussions and its use is varied between countries, there has been a strong push towards preventative care. And so more research and funding has been allocated towards developing the vaccine. While that is reactive, there is a proactive attempt to research the other species of mosquito that could possibly carry this disease. So while it is part of the discussion, more focus has been placed. There are countries, Brazil right now has been going door to door and going through homes and fumigating homes because of the gravity of the situation on the ground in Brazil. However, not all countries feel comfortable doing this. Local populaces are against that, but more are pushing towards preventative methods. Yes.
Beyond the dangers to pregnancy, what are the dangers to individuals? In other words, public at large.
Right. So the public at large, you'll express flu-like symptoms again, rash, conjunctivitis. It'll go away after. It varies between 5 and 7 days. It'll knock you off your feet, but it really won't hinder you in the way that it would if you were pregnant. So
Does it have lasting effects like yellow fever or dengue
dengue.
Yeah, dengue.
Right now, we don't know that, and so more research is being done to even understand the implications of this new virus. And so we only know right now the effects that it has on pregnant women, the symptoms of individuals who have traveled to countries that carry this mosquito, have been bitten and brought back to the United States, and the implications that it can have on individuals who are already immunosuppressed, like the case in Puerto Rico, which later caused the death of that individual. Yes.
Is there any type of possible morphology to the virus, i.e. will it change the way it infects people going forward?
Viruses can always kind of morph and evolve over time. You see this in the flu. That's why you should get a flu shot every year, because the flu strain can evolve and change. So it is possible that it could, but again, more research is needed into what exactly constitutes Zika and the capability it has for morphing into something else.
And as far as the 2016 Rio Olympics will say, what steps has the U.S. taken towards preventing our athletes and U.S. people who I guess would go travel for those games from possibly being infected by the virus?
Well, the United States has issued a travel advisory. So despite the attraction of the Olympics in Rio, the athletes themselves have been advised to not go outside and to wear long sleeves and to wear DEET.
Yes.
Again, because how do you fight a mosquito?
Good luck with that.
The CDC says don't get bit. Well, thank you for that, CDC. But by wearing long sleeves, by limiting your exposure to subtropical regions, if you are female and pregnant, try to limit your travel to areas of the world that have this mosquito, that have the Zika outbreak. So for the athletes, there is the female soccer goalie who is worried. And she has stated her fears publicly and is worried about even representing the U.S. in the soccer match down in Brazil in the Olympics. She's right now the face of the athletes, kind of pushing back. But again, as of right now, she's going to Brazil. She is planning on playing, but she's not planning on going outside unless it's for the game.
Wow.
Yes.
What is the U.S. government doing in regards to screening and perhaps quarantining U.S. citizens that travel abroad and then come back to the United States?
Unfortunately, there's a vulnerability within that system as well. Because these symptoms are very similar to many other diseases, you may not know that you actually have Zika. And so what's happened is that local public health departments get an overwhelming number of individuals who think, oh my gosh, now I have Zika. When really, unless you've traveled to a region of the world that has Zika, unless you've traveled recently to a country in South America, chances are likely that you do not have it. Again, it is not in the United States, except for these individual cases that resulted from travel. As far as containment, there are facilities in the United States that are fully capable of containing the spread of an infectious disease. And Zika would also fall under that. There's a top-notch facility in New York called Bellevue, which has a fantastic containment facility there. So.
But for instance, because I live in Dallas, 3 blocks from that first case of Ebola,
Yes.
where the guy didn't tell anybody he had it,
Right.
he knew he had it. But in the case of Ebola, it's very highly contagious.
Yes.
Now, in this case, it has to be transmitted by the Zika, by the specific specimen of mosquitoes.
Yes.
So the risk of a pandemic is not as big as Ebola, for instance.
It is not as big as
Because
fear
let's
of-
say somebody gets in again, and there will be,
right.
from Brazil, and they're sick with Zika.
Right.
Well, but if they're in an area that the mosquito's not there, they don't infect.
Right.
Do humans can infect each other?
Humans can, because it
Can.
has been found to be sexually transmittable. However, there could be an instance where an individual, such as the soccer player, travels down to Brazil and she gets bit by a mosquito.
Right.
She comes back to the United States, and a mosquito that is native to our local populace here bites her,
Oh,
can then possibly be infected with Zika, which would enable it to infect other people.
I see. I thought it took a special mosquito just to.
Right now, there are the two that carry it, but it has the ability to spread to other species of mosquito.
Yeah.
Yes.
Can you talk a little bit about U.S. government funding issues and specifically to the probability that there'll be gaps in capability with local and state governments and the need for federal funding?
Sure, I can speak to that a little bit. So right now there have been a strong reaction and a public outcry from the United States because the threat of Zika is so close to our borders. So the proximity of this virus and its potential to affect the new generation causes public outcry to Congress. Congress in turn has produced a bill to fight Zika, and it awards, I think the last one was towards U.S. aid and the Peace Corps. And so it's providing these organizations with funding to then go out to underdeveloped countries to conduct research and to train and inform local healthcare officials there so that they can then spread awareness and inform their own local populaces. Where there would be a gap is actually right now the bill for the Health and Human Services has been stalled in Congress. So while everyone has appeared to present approval of this bill and funding, it hasn't yet been approved. It hasn't yet been allocated to these organizations, such as the Health and Human Services, which controls the CDC.
On the same note, do you think one of the problems with getting such a bill passed through Congress is that maybe northern states at least the perception is they won't be affected as much as states in the South.
There is a perception of that. I'm not sure the feeling in Congress, but there is a perception that down in Texas and Florida, there is a much higher risk of contracting Zika because of the tropical climates that they share with South American countries. There is a push there, but again, I don't know exactly the reason as to why the bill has been stalled at this moment.
Thank you.
Anyone else? Okay,
Thank you, that was very good.
yeah.